So the Department of Medical Diagnostics of KNUST, came to realize that there was no means of confirming whether or not a person has abused drugs. And we have had problems in the past with the assignation with tramadol abuse. A number of people go to the hospital under the influence of alcohol. There are cases of accidents here and there, and there isn't so much out there that can be used to determine whether somebody has abused drug A or drug B. And as a department, we came to realize that we have what it takes to be able to develop urine test kits that can help identify these drug abuses. We then targeted the very common drugs that are abused and tailored our test kits to be able to identify them by a simple test strip, as is done with pregnancy testing.
So this is a 10-in-1 test for drug of abuse. The 10-in-1 test for drug abuse, it's able to detect different drugs. There are about 10 drugs that are in one. And so what you have, for instance, from this is we have amphetamines, we have barbiturates, you have benzodiazepines, you have cocaine, you have nicotine. So even if somebody is smoking cigarettes, you will be able to detect it. It's able to detect synthetic marijuana, for instance. There are a lot of people that would usually not take the marijuana because of the smell. They buy synthetic marijuana and they take it. You'll be able to detect it. It's able to detect morphine or the opiates, the TCA. It's able to, as I said, marijuana, and it's also able to detect tramadol. So all these 10 test kits or these 10 drugs are in a single test kit, and this is how the single test kit looks like. Now, okay, so what you do is that you take a urine sample and then you take out the test kit. When you take out the test kit from the pouch, it comes this way, basically, and then you have to just remove it from it. There are inscriptions on it that gives you a direction as to how you should do the test. You just dip it into the urine for a while. What you will see is that there will be a rise in this window. It's called a test and control window. You will begin to see a rise, and as you can see from here, some of the fluids have started rising. And as you can see, it started rising. Once it rises, what you're going to see is if it's 2 lines, it means that it is negative. If it is 1 line, it is positive. Except for tramadol. Tramadol, if it's 1 line, it's negative. If it's 2 lines, it's positive. But all of this is indicated in a form that accompanies it. So it's very easy to follow it and then be able to do it. So after you've done the test, after it begins to rise, you put it down for just about 5 minutes, and it should be able to give you the results. So when you look here, that is the results that it gives you. So as I earlier indicated, if it is 2 lines, it means that it is negative. So because this is water and this is not urine from somebody we suspect to have it, or we expect everything to be negative. As you can see, for the nicotine, they are both negative, because it's negative because there are 2 lines. Cocaine is negative. The benzodiazepines is negative, barbiturates negative, and then the amphetamines as well negative. When you turn the other side, it's the same thing except for tramadol, which is 1 line. Again, as I already indicated, 1 line for tramadol means that it is negative. So all of this is negative, including tramadol. So this particular test shows that the whole result is negative. Aside the normal drugs of abuse, we also have a test for alcohol. And then the test for alcohol is also a urine alcohol that is able to detect whether somebody has taken alcohol within 72 hours. It's also able to detect, it's a semi-quantitative, that basically means that it's able to give you an idea about the quantity that the person has taken as well.